The Kotoka International Airport resumed operations after about 5 months of closure to the COVID-19 pandemic. Prior to the reopening of the airport, stringent measures have been put in place to prevent the importation of new cases of the coronavirus. Director General of the Ghana Health Service, Dr. Patrick Kumah Aboagye, at a media encounter said since the airports began operations on September 1st, tests had been conducted on every single passenger with no positive cases recorded so far.
So far, we've not recorded any positive case, and that is what our ultimate aim is to. We are not here to catch positive people. Our ultimate aim is to ensure that people arrive here negative and truly negative.
Dr. Kumah Aboagye also defended the $150 testing fee, saying it was reasonable.
Where people are using PCR and they are charging, I hear Egypt is $30, some are $75, you will need to go to your hotel for a day or two to wait for your results. And so you have to put all that in the cost. And for someone, a new equipment like that, you expect that the cost build-up is not going to be easy. But even in that, you realize that it's still relatively cheap because you can look at the cost benefit. That is really not as exorbitant. So that, and we've also not had any significant protest from anybody who feels that the cost is expensive.
The director of the Ghana Health Service also disclosed that secondary schools that had recorded no cases of the virus would be allowed to go on vacation tomorrow, while those with infections would have to stay.
We are expecting that any school that did not experience any case, they can vacate and they all go home. Secondly, any school that has not reported any positive case in the last 2 weeks prior to the closure can also all go home. However, if there's any school where they've reported any positive case, we will do some assessment of contacts, and those contacts will have their vacation delayed, assessed before they go home.
Dr. Kumah Aboagye also gave an update on Ghana's COVID situation.
A total of 55 new cases were reported from 15 districts and four regions, as in the last count that we did. Eastern region led with 21 new cases from 3 districts coming from Lower Menya, Krobo, Kou, West, and Yulu, Krobo. Greater Accra, for the first time in the second, in terms of reporting total number of cases of 20 from 5 districts: Ayawaso West, Laradi, Kotopon, Gan East, Korle, Klote, and Tema. Bono East also reported 8 cases, 2 from 2 districts, the Chiman and Nkranza South, with Ashanti reporting 6 new cases in 5 districts: Ajuso, Offenso, Municipal, Achumakwa, Angoma, Fijakwabre, and North, and Oforokrum. The 12 regions did not report any case under this current review. So currently we're doing quite well as far as the numbers are concerned, and I hope we continue doing exactly what we are doing to keep it there.
On the controversy surrounding the Japa royalties deal, a Deputy Minister of Information, Pius Enam Adije, said the Finance Ministry yesterday had engaged the various civil society organizations on the matter.
This engagement was born out of government's desire to provide clarity and information so as to disabuse the minds of anybody who may have been misled to suspect wrongdoing. Government shall continue to work in the best interest of the Ghanaian people, use our nation's resource to leverage our assets for tomorrow.